Communication skill is at the heart of medicine. As a doctor, I need to communicate effectively with my patients, with colleagues. Communication is a two-way street. It's important to remind ourselves that when we communicate with patients, it is a two-way street. So we not only have to talk to our patient, we also have to listen to our patient. We need to know about our patient. We need to know about their health belief. We need to address their agendas, any concerns that they have. If you're new to this channel, hi, my name is Dr. Erwin. In this video, I'm going to show you how to elicit a patient's health belief system and how to address that. Because if you don't know what's your patient's ideas, what's their concerns, you won't be able to address them. So it's important that you consider this and you implement this in your consultation.
Having an understanding of the biopsychosocial model will enhance your communication skill as a doctor. What is a biopsychosocial model? The biopsychosocial model is an integration of the biology of the disease, the psychology of the patient, the health belief system, and the social implication of the disease on their life. So as a doctor, it's important to consider the biopsychosocial model. You're not just treating the patient's disease, you're treating a human being. So the human being has psychological aspect, has social aspect that you need to consider in your consultation. When a patient goes and see a doctor, the patient has an agenda. The patient may have a symptom such as a headache or a cough, and the patient also have an idea, may have anxiety, may have some thoughts about their symptoms, and they also may have some concerns causing worry to them, and they may have an expectation as well, what they can get out from the consultation. So these are things that you need to include in your consultation to be able to address each of them. Let's go through an example. A patient comes and see you with headache. So the patient comes in and says to you, "Doctor, I've been suffering with this headache for a few weeks now." Most doctors are trained to take a medical history and will elicit history where they will gather information about the onset of the headache, the duration, the intensity, the severity, any triggers, any red flags. So these are important elements of the biopsychosocial model. So this is covering the biology of the disease. The next step is to cover the psychology. You need to understand the patient's health belief model. You need to understand the anxiety that the patient may have. You need to understand what's causing this patient to come and see you now. This is where the idea, concern, and expectation fits in. A question you could ask to elicit the patient's idea is, "Had you have any thoughts about these symptoms?" So the patient might tell you that, "I've been worried about this, it's been stressful at work." The patient might think that stress is causing this, or the patient might say to you, "I don't know, doctor." So the patient may have no idea what's causing this. If you don't tend to ask patients about the ideas, concern, and expectation, it may seem a little bit strange to you because the patient is coming to you and you are asking the patient what they think is wrong. The reason you elicit the idea is so that you can address it, so that you know where the patient is at. If you don't know what the patient is thinking, then you may not be able to help the patient. For example, if a patient comes in and thinks that he has a brain tumor, if you don't ask the patient about that, they might not even tell you because they might feel too embarrassed to tell you or too worried to tell you. So that's why it's important to ask about the idea. Once you've asked about the patient's idea, then you could also ask about the patient's concern. You might ask, "What's been going on in your mind?" So the patient might tell you a little bit more about their worry, anything that's been concerning them. Remember, idea and concerns come first before expectation. Once you've understood the ideas and concern, then you can ask them about the expectation. You could ask them, "What were you hoping I could do to help you today?" So this will help you to gauge what is the expectation. A patient might have an expectation that you'll give them some pain relief and they'll be all right. Or a patient might have expectation that you might have to send them to the hospital for a scan. So when you know what the patient is expecting, then you can address this in the second part of the consultation when you formulate your management plan. When you have all this information about idea, concern, and expectation, you can tailor a management plan that will best suit the patient instead of a generic management plan. It's vital when you're asking about idea, concern, and expectation that you don't force it on the patient. It needs to come naturally. So the patient might tell you the story. They might leave cues in their story. So you need to be listening to the patient attentively and pick up on these cues and ask follow-up questions about what they've just told you. So for example, a patient might tell you that I've been having these headaches for a few weeks. It's been very stressful at work. The headache comes on, blah, blah, blah. So here the cue is stress at work. So you need to explore a little bit about that. This might tell you whether the patient thinks they're stressed or whether there has been some changes at work that could be causing this headache. So this is why it's important that you listen attentively and pick up cues. It's important to keep an open mind when you ask questions about ideas, concerns, and expectation. Let's take ideas for example. If you're going to ask a patient a question about ideas, you want to know their thoughts, you want to know what's going on in their mind. Some doctors tend to ask narrow-ended questions about ideas, so they keep the question narrow to the cause. It might work for a patient coming with headache, so you might ask, is there anything in particular you think is causing this headache? I'm worried I have meningitis, doctor. However, if a patient comes in and wants to know more about contraception, so what are you going to ask? What you want to know is what they think about contraception, what is their ideas about contraception. A more valuable question would be, what are your thoughts about contraception? Let's take another example with concern. So if you ask a patient a question about the concern, and if you ask a narrow-ended question, you might say, is there anything in particular about this headache that's concerning you, Mr. Smith? With this question, the patient may not have any concern at all with the headache. Then you might find out later that the patient had concerns, but you did not ask an open-ended question to gather that information. A different question that might yield more information would be, what is worrying you, Mr. Smith? When you ask such a question, the patient might open up and tell you, I'm worried about my exam, doctor. I've got an exam in 2 days' time. When the patient opens up and you're asking these questions about ideas, concern, and expectation, don't just go through the question as a tick box exercise. It's important that you keep the conversation going. It needs to be an exchange, not an interrogation. So when you ask a question about idea, the patient might say, I'm worried about meningitis. You need to reflect back to the patient. I hear you, that can be frightening. What do you know about meningitis? Another example is, you've asked a question about concern, and the patient tells you, I'm worried about cancer. It might be the first time that they're opening up about this fear that they have. So reflect back to the patient and you may say, I can see you're obviously worried, Mr. Smith. By acknowledging the fear of the patient, you show empathy and build more rapport with the patient. Let's take another example with expectation. You've asked a question about expectation and the patient tells you, I'm hoping you can refer me for a CT scan, doctor. You might reflect back and say, I appreciate you would like a scan. We'll discuss that in a moment. Once you have gathered ideas, concern, and expectation, it's also important to consider the social aspect of the biopsychosocial model. It might be worth asking about how their symptoms impacting at work, how their symptoms impacting at home. You need to know how their life has been affected. To what degree have their life been interfered because of the symptoms? For example, if somebody has headaches and they've had to take some time off at work, so this is becoming more serious. So this is important to ask about. When it comes to the social aspect of the consultation, it's also worth to ask about health habits. Some habits that we have can impact our health. For example, if a patient is smoking, this is going to affect their health. This is going to make them at higher risk of cancers. It's going to affect their lungs. If a patient is drinking alcohol, you need to know how much they are drinking. Alcohol consumption has implications on a patient's health. As you can see, integrating the biopsychosocial model in your consultation will help you to have a holistic approach and to look at the patient as a human being rather than just diagnosing and treating a disease. Integrating the biopsychosocial model will take time and practice. It's important that you practice and practice. It will come naturally the more you practice at it. If you find this video useful, go ahead and smash the like button so that I know you want more videos like this. Let me know what's your takeaway from this video. Write down in the comment section what's your takeaway. Thank you for watching this video till the end. If you've not already subscribed to this channel, don't forget to subscribe and hit the bell to be notified for future videos. I hope you find this video useful. Take care everybody. Bye bye.